Hi guys, welcome to today's live. My name is Dr. Felix Ifa. I'm a neuropharmacologist and toxicologist. Now, if you are new to this page, please subscribe, hit the notification button so that when I come on live, you'll be able to be notified. But if you're not new, then welcome to today's live. I am going to be discussing about cholesterol and how to reverse or how to decrease your cholesterol in 1 month. Now, I do evidence-based medicine, so everything that I'm going to talk about today is obviously backed by science. Now, please do subscribe for me. What are you waiting for? Subscribe so that this page can grow and I can give you more information, educational and healthcare tips. Now, a lot of people go to the doctors and then the doctor will tell them that their cholesterol levels is high compared to, their bad cholesterol, quote unquote bad cholesterol, which is the LDL levels are high compared to the HDL levels. Now, your doctor will do a ratio and then they will tell you that the ratio is very high, right? So therefore, there's something that you need to do about it. If it's too high, then they will put you on statins, right? Which is basically going to try its best to decrease the cholesterol levels. Now, because I do evidence-based medicine, I will give you some of the, background or the pathophysiology of cholesterol and why it leads to some of the conditions that it leads to. And then I will give you some tips that you need to do in terms of like the vitamins, the food and the drinks that you need to take in to reduce your high cholesterol, which is your LDL levels being high. And then, of course, it decreases your chances of heart attacks. It decreases your chances of strokes. But before that, one of the issues of cholesterol, and a lot of people have, they say, oh my God, my cholesterol is high, and they get very agitated. Now, you don't have to worry too much because cholesterol, your body makes cholesterol. The reason why your body needs cholesterol is because it is the backbone of a lot of hormones and a lot of product that your body makes, the molecules that your body makes. So, for example, testosterone, which is a hormone, has cholesterol backbone. Your body needs cholesterol to make testosterone, progesterone, estrogen, cortisol, and the list continues. It also makes cholesterol for your cells. So it needs cholesterol for your brain. In fact, your body needs cholesterol because, yes, it depends on it. Now, one thing that you guys need to understand is that the body, it makes about 100 milligrams to 200 milligrams of cholesterol daily by itself. And so when a lot of people think that the cholesterol that we eat, the dietary cholesterol is the reason why cholesterol levels are high, I get very worried about it. No, your body makes cholesterol by itself. Now, of course, later on, I will tell you how to even eat certain foods to decrease your cholesterol naturally. Now, before I forget, let me tell you that if you're eating foods that are high in fat, like avocados, like, good fat, like avocados, like fatty fish, like salmon, like your walnuts, these are going to sort of like suppress your bad cholesterol, right? This is because if you're taking in dietary cholesterol, right, which are good fats, your body will not be making more. But if you're reducing the dietary fat, which is like avocado, your walnuts, your fish, then your body would make the cholesterol by itself. I don't know if that makes sense, but let's go into details. Now, when your cholesterol levels is up, it is not necessarily a bad thing. The only issue is that when you also have what we call endothelial damage. Now, what is exactly endothelial damage? A lot of the times, what actually makes the cholesterol dangerous is that in your blood vessels, in your arteries and veins, you may have damage to the endothelial cells, which are the lining of your blood vessels, right? These are coming in contact with your blood. So your blood is flowing through this blood vessel. Now there are several layers. So you have the smooth muscles, you have all those kind of, so that makes the endothelial, blood vessels. Now, when there is a damage inside these endothelial cells, then you have what we call inflammation. But what are some of the risk factors for the endothelial cells to be damaged so that then cholesterol will come and, build up there? Some of the conditions I will tell you, but let me tell you why cholesterol is such a big thing in the medical world. When you have cholesterol, your doctor will just be like, oh my God, the cholesterol is high, we need to bring it down. That is because it leads to conditions like heart attacks. Now, here's the thing. When you have damage in your endothelial cells, guess what is going to happen? The cholesterol that is basically high in your bloodstream will come and deposit in that damage endothelial cells, which is in your blood vessel, and then it builds up, as you can see here in yellow. The more it builds up, the more it basically blocks the passage, the way of your blood, making it difficult. And at some point, if it blocks the whole thing, then your heart will not get the oxygen that it needs, and then eventually your heart will stop beating, and that's how you get like cardiac arrest, right, or heart attack, right? Good. Now, unfortunately, if these plaques are built up in your blood vessels, in your brain, then we have strokes. Now, of course, there are two types of stroke. We have hemorrhagic or ischemic. Hemorrhagic means that, when your blood vessel is blocked and your blood is trying so hard to push through because your demand of the brain is so high, it is either going to rupture, or when it ruptures is what we call the hemorrhagic. So there's going to be blood, flowing, blood literally like, pouring in your brain. Now, when it basically blocks and is not being able to push, and it, after the blockade, there's no blood flowing through. And so the part of the brain that is blocked will not get oxygen. That's what we call ischemic. So there are two types of strokes, hemorrhagic and ischemic stroke. Now, let's look at how some of these plaques are formed. You see, inside the blood vessel, because there's endothelial damage, the plaques are formed inside it. And this is extremely dangerous. And that is why your doctor will put you on statins ASAP. Now, you don't necessarily need statins. Sometimes you can actually do natural remedies. You can actually take certain vitamins, and that is exactly the reason for this live. So I can tell you what exactly you need to do to decrease your cholesterol levels significantly in a month. And this is evidence-based. This is not just me sitting here talking about things that I have no idea about. I'm going to give you evidence-based. Now, before we actually talk about why plaques formed and why cholesterol, which is not necessarily a bad thing because your body needs cholesterol in the first place, why it deposits in the endothelial cells. Of course, like I said earlier on, when there is a damage in the endothelial cells, which is the lining of your blood vessels, then the cholesterol may deposit. And how does the damage happen in the first place, and why does it happen? Some of the conditions that actually induces damage in the blood vessel, we can guess, is when you have sugar levels high in your bloodstream. Now, every single day, we see I have a teaspoon of sugar shown here. That is the amount of sugar that is supposed to be in your bloodstream, right, per day. However, the issue is that the average person eats about 50 to 100 teaspoons of sugar per day. Now, a lot of people think that when we talk about sugar, it's just processed, like just the tablespoon sugar. No, even carbohydrate will be transformed into sugar, right? So when you go to the hospital and you've taken a tablespoon of processed refined sugar and you've eaten 5 burgers of McDonald's, and your blood sugar levels have spiked and you're diabetic and your blood sugar levels are spiked, your doctor will not, or the A&E doctor or the doctor who is going to take care of you is not going to say, oh, because you took tablespoon of sugar, you will stay, and the person that took like 5 burgers of McDonald's should then go home. No, it is all going to spike your sugar levels significantly. So what essentially, see here, when you're eating all these foods, processed meat, and we are not getting sort of like fiber and stuff like that, this would increase the blood sugar levels. And essentially, this is what exactly is going to happen. Essentially, you see here the white part, when the sugar levels in the bloodstream is so high, it is going to be toxic. Now, the beautiful thing about sugar is that our body needs the glucose for energy. However, when the levels are too high, then it's going to be toxic for the organs, not just for the organs, but also for the endothelial cells, which are the lining of your blood vessels. So the sugar is hurting the very vessels, the very channels they are flowing through, because the levels are so high. And one of the reasons why. And so guess what is going to happen? Your pancreas is going to try its best to to release a lot of insulin. But you see, when you're young, the insulin is going to be high, but then over a long period of time, like 15 to 20 years, the insulin levels are going to drop. So you have less insulin, and without insulin, glucose cannot enter the cells. Now, guess what? Then you will have high glucose level in your blood, which then will lead to more inflammation, which also will lead to more damage in your endothelial cells, and then your cholesterol will dampen in your blood vessels, which then increases your chances of heart attacks, which is, very dangerous, right? Now, then you would have to go on, insulin injection, just like a lot of diabetic patients are on insulin injection. So you have to inject the insulin by yourself because the pancreas is literally tired. You've overworked the pancreas, so the pancreas is not able to make any more insulin for you, right? Now, another thing that can actually rupture or destroy your endothelial cells in your blood vessel, leading to plaques formation and cholesterol, build up there, is high blood pressure. When your blood vessels are receiving a lot of pressure because your blood pressure is gone up, guess what? It is going to sort of like rupture the lining of the blood vessel. So as more pressure is being exerted on it and there's rupture, guess what is going to happen? That will also induce the plaques to go and try to fill that gap. Now remember, plaques are built not necessarily because your body wants to harm you. Plaques is a way of sort of like trying to amend the damage that has happened. So then you will have plaque go in there trying to sort of like restore that damage or repair that damage. So plaques, you will have cholesterol go and deposit there. You will have calcium, and then you will have protein. Now, when you have this, of course, and the cholesterol levels are high, more is going to be dampened there, building a mountain, a mini mountain in your blood vessels, which then will decrease the diameter that the blood has to flow through your body, and then eventually blocking it. And then, of course, depending on where exactly happens, right, the plaques can then tear off. And if it goes to your lungs, you will have PE, pulmonary embolism. If it goes to your heart and blocks your coronary artery, like you saw before, it will then give you angina, which is heart pain. And eventually, if it blocks, if it's big enough to block the whole coronary artery, then it's gonna probably lead to MI and eventually heart attack. If it goes to your brain, then you have strokes, whether hemorrhagic or or ischemic. Now, if it happens in your legs, you have deep vein thrombosis, right? And so plaques are not necessarily a good thing. So that is why it is extremely important that your doctor actually goes to the root cause of the issue. So if you, for example, have high blood pressure, it is extremely important that you decrease your high blood pressure. If you have diabetes, it's extremely important that you decrease your diabetes, because these are going to be the confounding factors or the contributing factors to induce high cholesterol, which would then be depositing in your bloodstream, forming plaques, and then eventually leading to heart attacks. But don't worry, I will tell you some of the things that you can do to reduce your cholesterol levels. Now, the beautiful thing is, even if you have endothelial cells damaged, right, because you have because you have your glucose levels high and your blood pressure is high, and your cholesterol is regulated, then they're not going to be dampening there. Or even if they are dampened there, there are also some vitamins or some things that you can take to sort of like sweep them away from your bloodstream, making the bloodstream, free of high levels of cholesterol and triggering proper healing of your endothelial cells. I'll give you all that. Stay with me. Now, apart from high blood pressure, smoking, people that smoke cigarettes can also increase their chances of, damaging their blood vessels, because the smoking contains so many toxic compounds that are about 8,000 toxic compounds. Yesterday, I did a live on smoking and vaping and how that actually destroys the health. If you have not watched it, go and watch it. I did it yesterday. But smoking contains about 8,000 chemicals and 69 carcinogens. 69 carcinogen means that they can directly cause cancer. And so I urge each and every one of you guys, if you're smoking, please stop smoking, because it is very, very detrimental to your health. Apart from smoking, you also have vaping. Vaping will cause less of the harm, but it's also going to cause harm. Of course, we've shown that it is not as toxic as cigarette, but it's definitely not going to be very good for your health either. So it is extremely important that if you're someone who vapes or even shisha, a lot of ladies of late are doing a lot of shisha. I don't even know how we got here, but shisha, with all the flavors, it also contains tobacco, and you're burning this stuff and then you're inhaling in you. These are going to your bloodstream, and guess what? It is going to damage your blood vessels. The more damage you have in your blood vessels, the more you increase the chances of cholesterol dampening there, and then you form plaques, of course. So now, pollution is also one of the risk factors for atherosclerotic plaques formation, because these, imagine living in an industrial area and you have gas being produced all the time. That gas will contain fine particles. Now, when you inhale these fine particles, they can go into your lungs and they can cross what we call the alveolar cells, and then they can get into your bloodstream. When they get into your bloodstream, because they are very toxic, they can now go and damage your blood vessels, the lining inside your blood vessels. Then, guess what? Your body will try to heal it with cholesterol being dampened in there, with calcium and with proteins. And so it increases your chances of, forming plaques, which then could increase your chance of, like I said earlier on, heart attacks and strokes. Now, or PE, pulmonary embolism. Now, let's look at some of the things that can help you reduce the inflammation that happens in your blood vessels, leading to cholesterol dampening there, which of course no doctor wants whatsoever. Well, you guys can give a guess. Well, the sun actually has what we call infrared. The infrared basically induces nitric oxide. Nitric oxide is a vasodilator. So that is why when a person actually goes to the hospital and their blood pressure is extremely high, guess what? You're probably giving nitric oxide. So that's going to dilate the blood vessels and decrease the inflammation, making sure that the blood can actually flow very easily. Nitric oxide would quickly sort of like if you have high blood pressure, nitric oxide will decrease your blood pressure very quickly, because it is a vasodilator. Now, apart from that, the sun actually gives vitamin D3 when the sun hits your skin directly. And I want to clarify something here. A lot of people think that the fact that they go under the sun, they can get vitamin D3. No, it is not that obvious. If you're wearing a cloth like this and the sun is not hitting directly to your skin, guess what? You're not gonna get your 7-dehydrocholesterol synthesized. Now, the fact that you're under the sun doesn't necessarily mean that you're gonna get your vitamin D levels optimized. One, because maybe you are bleaching, you're using creams that have hydroquinones, which are gonna interfere with your keratinocytes, so vitamin D is not gonna be synthesized under your skin. Apart from that, if you're someone who, of course, wear clothes like these, the sun will not hit your skin. And apart from that, if you have liver issues, say you have fatty liver, non-alcoholic fatty liver, or you have fatty liver induced by alcohol, because the vitamin D3 has to be, metabolized or have to be activated by your liver and then made and then by your kidney finally for the active form to be used by your body. If you have any liver issues, or kidney issues, you are not going to get your vitamin D levels synthesized, right? Or activated. Now, guess what? Vitamin D is arguably the most powerful inducer for nitric oxide synthase, which is the enzyme that basically synthesizes L-carnitine and L-arginine. I believe I'm saying the proteins right. So basically, the L-arginine is basically going to be converted by the enzyme nitric oxide synthase into nitric oxide, which then is going to dilate your blood vessels. And so without vitamin D, the L-arginine is not going to, even though you have adequate amounts of it in your bloodstream, because the enzyme, the nitric oxide synthase, is not present in high amounts, it is not going to be converting into nitric oxide. So vitamin D is a powerful inducer of nitric oxide, which then will dilate your blood vessel. And that is why taking a lot of patients, they tell me, Dr. Felix, ever since I started taking my vitamin D3, K2, my blood pressure has decreased significantly. Of course, because vitamin D3 is inducing nitric oxide production, which then will lead to, guess what? Will lead to your blood pressure coming down. Now, I've talked about vitamin D3 as well. Now, of course, if you're not someone who is exposed to the sun, like in Africa, or even if you're in Africa, you need to be spending at least 2 hours under the sun for the sun to directly hit your skin before you get your daily dose of vitamin D3. Why? Because if the more melanated you are, the more time you need to spend under the sun. And also, the more melanated you are, the less vitamin D3 you are going to get absorbed, even if you're eating food that are rich in vitamin D3, like eggs, like salmon. You're still not going to get your vitamin D3 because melanin interferes with the absorption of vitamin D3 in the gut. Ideally, you're supposed to get it under the sun. And that is why I always advise melanated people to take a little bit of a high dose, which is minimum 10,000 international units, but take it with the K2 so that you can increase your nitric oxide production, and then you are also decreasing inflammation within your blood vessels, making sure that the cholesterol that is high does not induce more damage to your blood vessels. Now, apart from that, one of the things that has also been shown to induce nitric oxide is garlic. Garlic is a very powerful inducer of nitric oxide formation. And so if you look at our Asian brothers and sisters, you see that they actually eat a lot of garlic. If you're someone who has sort of like high blood pressure, for instance, or you have a lot of inflammation within your blood vessels, please make sure that you're inculcating garlic into your food. The smell is very strong, but it is health over smell. So make sure that you're incorporating garlic in your diet. Apart from that, exercise has been shown to be one of the most powerful inducers of anti-inflammatory properties in the bloodstream. So when you're exercising, you increase metabolism and also you regulate the cholesterol levels in your bloodstream. So you have more breakdown of your bad cholesterol, which then will be reduced, and your HDL levels are going to be also increased, therefore decreasing your chances of plaque formation and reducing cholesterol significantly. Apart from exercise, fasting is so important for LDL levels decreasing. Now, let me explain why. A lot of people will start fasting and they will say, Dr. Felix, ever since I started fasting, my LDL levels have gone up. Why is that the case? That is only temporary, right? It is not going to be permanent. Now, think about this. When you start fasting, your body actually in your fat cells has stored a lot of the of the cholesterol and the fat and the fatty acids. And so as your body now goes and take the fatty acids out of your fat cells, because it needs to use that for energy, your cholesterol, your LDL cholesterol, is probably going to be up for a bit because it is taking it out. It's basically taking all the stuff that is stored from the garage, which is your fat cells, and trying to clean the place. But then eventually, the more it is, taken out and clean the place, over time, your LDL levels are going to come down and your body is going to regulate the levels really, really well. So it is extremely important that we know fasting is going to decrease your LDL levels significantly. Like if you were to fast at least 12 hours, ketogenesis actually happens. If you were to fast 12 hours every single day, right, and you eat only one meal a day, and of course if you're eating that 1 meal a day, make sure that you're eating keto diet. So diet that is very, very low in carbohydrate. You're eating high fat diet like your avocados, your salmon, your nuts, your eggs. These are going to, guess what? Like I said earlier on, they are going to reduce your LDL levels significantly, and they are going to increase your HDL. Now, guess what? The more your HDL levels are increased, the HDL is going to be the one that drives away the LDL, the bad cholesterol into your liver. Then your liver will basically break it down and excrete it, the excess excreted from your body. And fasting is also a very powerful inducer for to lower your cholesterol. Now, before I go to the next one, this is by far one of the most powerful vitamin that has been shown. There is a ton of literature that has shown that taking this particular vitamin can significantly reduce your blood cholesterol levels significantly. In fact, let me tell you guys something. Before statins were developed or discovered or whatever, produced, this particular vitamin was what was used or prescribed by doctors to be taken for high levels of cholesterol, your LDL levels being, and it works like magic. Now, do you guys know what exactly this vitamin is? You can take a guess. Well, I hope you guessed vitamin B3 or niacin. Vitamin B3 has been clinically shown to reduce cholesterol levels significantly, the bad cholesterol. Not only does it reduce the bad cholesterol significantly, but it also increases the good cholesterol. So whilst it is reducing LDL, it gets your HDL levels up. Now the HDL will also now scavenge the bad ones out of your body, which is going to maintain a very good ratio. So yes, niacin, vitamin B3 is your friend if you have high cholesterol. Now, what are the levels? There are two types of niacin. You have non-flash and then you have the flash. So a lot of people will say that, Dr. Felix, when I take niacin, I feel very itchy. Well, you might as well try the non-flash, right? Now, 500 milligram of niacin is the one that has been shown to be very effective in reducing the LDL levels, the bad cholesterol levels in your bloodstream. But if you're taking the 500 milligram of B3 and you think it's a little bit too high, you can decrease the concentration. Now, a disclaimer here. I would also urge you to speak to your doctor first. If you start taking niacin to reduce your cholesterol, make sure that you go and do your blood works, every 3 months to see whether your cholesterol levels are decreased. Because if you don't also want your cholesterol levels, your LDL levels to decrease too high to the point where then it basically, because remember when I said earlier on, your body still needs the cholesterol. It's just that when it's in high amounts, you don't want. So every little thing in moderation, every little thing, because your body needs the cholesterol to make the hormones. Like I said earlier on, the female hormone estrogen depends on cholesterol. Progesterone depends on cholesterol. The male hormone testosterone depends on cholesterol. Vitamin D3 itself, hormone D3 has a backbone of cholesterol. So cholesterol is not necessarily a bad thing. When it's high, that is when it becomes a problem, right? Now, apart from that, if you are someone who also has high cholesterol in your bloodstream, whilst you're taking niacin, please make sure that if you're taking vitamin D3, 10,000 IU, make sure that you take the K2 with it. Here exactly what the K2 is going to do. The K2 will make sure that it drives away all the calcium from your bloodstream. Now, remember, like I said earlier on, even when you have high levels of cholesterol, now if you don't have the calcium levels being high, calcification of the plaques is not going to occur. When there is calcification of the plaques, that's where we have a real issue, because then it is not soluble. It is not going to be dissolved. It's going to be very rigid. Now, imagine a little ball of plaques roaming in your bloodstream. That is very, very dangerous. And that is why, we call clots. When you have clots in your bloodstream, that is very, very dangerous. And these clots, when there is calcification in it, it is going to be almost impossible to dissolve it, right? And so it is extremely important that whilst your high levels of cholesterol is being treated, take your vitamin K2. Now, one beautiful thing about K2 is that you can get it from leafy greens if you eat a lot of leafy greens. But if you're taking vitamin D3 K2 from Dr. Fels, which I produce, you have the D3 and the K2 put together. So you don't have to worry about going to take K2 separately or worrying about the potential side effects of vitamin D3, which is hypercalcemia in your bloodstream. But then the K2 will drive all the calcium to the right places, to the teeth, to the bone, so you don't have to worry too much about it. Now, so K2 is your friend if you have high cholesterol. Now, I've not even gotten to the most powerful drink for cholesterol levels that decrease cholesterol levels significantly. Now, I hope you actually wait to the end before you go, because you may actually lose this very important information. That is the reason why I actually did this live in the first place. So, high fat diet. If you have high cholesterol, you need high fat diet. High fat diet. A lot of people think that it is counterproductive, right? So your avocados, your leafy greens, and your olive oil, your coconut oil, and all those kind of oils. A lot of people, and including scientists and doctors, they think that when you eat dietary fat, this dietary fat is going to increase your cholesterol levels. That is not true, actually. The dietary fat, because they contain antioxidants, because they contain polyphenols, because they contain minerals and vitamins, they are going to be the very ones that reduce your LDL levels and maintain a healthy balance of LDL and HDL. Why? Because if your body does not receive the external dietary cholesterol or dietary fat, it makes high levels of the cholesterol. But if it receives it from external, the more it's receiving from external, it does not make its own. So that then it regulates the levels really nicely. So avocados are your friends, guys. Avocados. I love avocados. I eat avocados every single day. Lately, I've not been eating as much, but I try my best to eat at least half an avocado every single day, because I need to take my vitamin D3, K2 in the morning, and then in the evening, magnesium. Ladies and gentlemen, one of the reasons why magnesium, if you are someone who has cholesterol, you need to take magnesium, is that, remember, magnesium and calcium do the opposite thing. So magnesium is basically the opposition of calcium. Calcium makes everything rigid and it makes everything calcify. Magnesium makes everything relaxed, and it basically is like that cool mother that does not allow your father to do, to shout at you or to maltreat you or whatever the case may be. That is how magnesium operates. So when you have high cholesterol in your bloodstream, make sure that you're taking magnesium. Well, of course, the one I advise is magnesium glycinate, because that's the one that is more bioavailable. Now, when the magnesium actually goes in your bloodstream, it basically relaxes your blood vessels. So even if there is some deposition of cholesterol in your bloodstream, it is gonna, instead of it being like this, it's gonna dilate it so that your blood vessels are going to, guess what? Be relaxed. And also, magnesium is going to oppose the activity of calcium. So even if there are some calcifications there, it's going to relax the calcium and oppose the calcium, so that then the plaques does not form too big. Now, these are some of the benefits. Magnesium has very, very, very amazing benefits. For example, you're going to be able to sleep well. Now, when you're sleeping well, because you're taking your magnesium glycinate, about 150 to 300 milligram, well, Dr. Fels Naturals has these. Now, these, if you look at the back there, that's vitamin D3, K2, and magnesium glycinate next to the mannequin. You're going to have an amazing sleep. Now, the beautiful thing about Dr. Fels Naturals vitamin magnesium is magnesium bisglycinate. it is so absorbable and is so bioavailable that when people take Dr. Fell's Naturals vitamin D3, K2, magnesium glycinate, they see the effects literally in 3 to 5 days. And then they just reach out to me and be like, whoa, that's crazy. And apart from that, I also have acacia fiber in it, which will basically be very gentle on your gut, feed your gut microbiome, and then make you empty your bowel every single morning of the day, so that you're basically healing a lot. But then the beautiful thing is, the magnesium is going to give you so much good sleep. The more you have good sleep, the more you are regulating your body, the less chances you have of having high cholesterol in your bloodstream, which then will decrease your chances of heart attacks and strokes and all those kind of things that we do not want with high cholesterol in your bloodstream. Now, nuts. So many people don't know that nuts, your walnuts, your almond, your cashew nuts, all these nuts are very good if you have high levels of cholesterol, bad cholesterol in your bloodstream, because the nuts are containing some of the fats, and these fats are going to decrease your LDL levels. Right? Fantastic. Now let's go to the last one where I wanted you guys. Oh my God. This one has been a very powerful reduction of LDL levels in the bloodstream. Now, I want you guys to take a guess. If you did take a guess, please make sure you write it in the comment section before I say it. Write it right now so that we know whether you were right or not. Well, a lot of people will not know that this is actually the very drink that can decrease your cholesterol levels significantly. Now, apart from that, it is going to be a very powerful antioxidant. It is going to be a very powerful anti-cancer. It is going to be a very powerful. In fact, when scientists compared this drink with exercise, with the effect of mild to moderate exercise, just by consuming 1 cup of this drink can be compared to you exercising mild to moderate for about 40 minutes. That is crazy. So what is this drink? It is exactly cacao powder. Cacao powder has flavonoids, right? It basically has so many powerful antioxidants. Now, if you were to drink cacao powder, not the one that has sugar put in it, but the pure cacao powder, the 100% organic one, if you were to mix every single morning and to make it a drink in the morning with a warm water, you would significantly, over a month, reduce your cholesterol levels. Now, apart from that, you would also reduce your oxidative stress, which then would increase your chances of having damage in your endothelial cells, which then, of course, will increase your chances of building plaques, which then, of course, increases your chances of heart attacks and strokes. And so cacao powder is very, very powerful. And that what I actually essentially do is I mix the cacao powder with, you guys guess what? Beetroot powder. When you mix these two together, the beetroot powder will increase nitric oxide production, and then the cacao powder will basically decrease your cholesterol levels whilst presenting you with powerful antioxidants. And so, listen, you might want to order cacao powder, organic one, because a lot of countries do spray upon these cacao. So make sure that you're getting the organic one. I think, and I'm hoping that they are organic, as they say, of course. And so, yes. So today, with these amazing minerals and amazing vitamins that I've actually given you, I truly do hope that you follow what I've actually taught here, and in a month, if you were to do this religiously for a month, you would significantly reduce your cholesterol levels, and you would regulate your cholesterol levels, which then decreases your blood pressure. It also decreases, if your blood pressure is decreased, it decreases your chances of having the cardiovascular health issues and neurological issues like strokes. So just to recapitulate, I talked about spending time in the sun, of course, vitamin D3. I talked about niacin, vitamin B3. So D3, B3. I talked about vitamin K2, which then would be having an effect on the calcium, driving all the calcium away from your bloodstream. I talked about magnesium. Magnesium will oppose the activity of calcium. I talked about then I talked about the foods that you can eat. I talked about the high fat meals, so the keto diet, salmon, avocados, nuts. Then I talked about fasting. If you're doing fasting, 1 meal a day is amazing, but when you break your fast, make sure that you're breaking your fast with these high fat meals, so that then they sort of like antagonize the production of your body's cholesterol in your bloodstream. Thank you so much for listening. Next time, I will talk about high blood pressure and some of the natural remedies to reduce high blood pressure. And then the next video will be on fibroids, how to naturally decrease fibroids. Guys, if you've not subscribed to this channel, make sure you subscribe to it, share it to a friend, share it to a brother, let them come and learn these things, because I spend so much time researching some of these things so that then I can break things down for you and then we can all benefit from it. But yeah, you don't necessarily need statins. You can do some of these things to reduce your blood cholesterol levels significantly, because statins, guys, if I start mentioning the side effects, there are about 500 side effects, and I'm sure you do not want that. Thank you so much for tuning in, and I will see you next time. If you've not subscribed, please subscribe, hit the notification button. God bless you. Bye-bye.